Hello, I'm Dr. David Treen with Surgical Clinic of Louisiana and West Jefferson Medical Center. Today we'll be discussing the risks and benefits of bariatric surgery, as well as who may be a good candidate for these life-changing procedures. Bariatric surgery has many benefits. Surgery and the weight loss it produces can alleviate or even cure many obesity-related diseases such as hypertension, diabetes, high cholesterol, sleep apnea, polycystic ovarian syndrome, and decrease the risk of many cancers. If you're a healthy person who struggles to lose weight, surgery can help prevent those diseases from developing. For some patients, bariatric surgery can even add 10 to 15 years of life. While bariatric surgery is safer than common procedures like a knee replacement or gallbladder removal, there are risks. These include infection, bleeding, which could require a blood transfusion, and dehydration or malnutrition. While these risks are low, it is still important to be aware of them. You will need multiple consultations prior to your surgery and extensive follow-up afterward to ensure that your recovery proceeds as safely as possible. A good relationship with your surgeon and our team is essential to minimize these risks and having a successful experience. In the journey to a healthier you, mindful eating and exercise will be essential to maximizing your weight loss. We will also strongly advise vitamin supplementation for the rest of your life for best patient outcomes.
Hello, I'm Dr. Peter Lundberg, and today we'll discuss the weight loss surgeries we offer here at West Jefferson Medical Center. All procedures are performed laparoscopically, using 4 to 6 very small incisions to perform large operations on the stomach and small intestines. Most patients are discharged home the day after surgery and require minimal pain medication. Dietary and activity advancement is closely monitored, but most patients can return to work within 1 to 2 weeks after surgery. The vertical sleeve gastrectomy, also known as the sleeve, is performed by using a stapler to cut off the majority of the stomach. This creates a slender, small stomach pouch that receives food from the esophagus and empties it into the small intestine. The separated portion of the stomach is then removed from the body entirely. With a smaller stomach, you feel full sooner and you eat less. The sleeve also produces moderate changes in your intestine's ability to absorb calories. On average, a sleeve gastrectomy patient will lose 50 to 70% of excess body weight. The sleeve is the most popular bariatric surgery for several reasons. It is technically simpler to perform, and it has a lower risk of malnutrition or alterations in intestinal function than the gastric bypass. That said, it also has some risks. First, there is approximately a 0.2% chance that a leak along the staple line can happen, which causes whatever is inside your stomach to leak out and cause an infection. This can require additional procedures and take several weeks or months to heal. Second, because your new stomach has a higher pressure due to a smaller size, roughly 30% of sleeve patients experience new or worsening heartburn or reflux. Most patients can control their symptoms with dietary modification or medication. In rare cases, surgical revision may be required to fully address this problem. Sleeve gastrectomy is a safe and effective treatment for excess weight and an excellent option for motivated individuals.
Hello, I'm Dr. Vaughn Nossman, and today I'll be discussing the Roux-en-Y gastric bypass, also known as bypass. During this procedure, your surgeon staples in a different location on the stomach, creating a small pouch the size of an egg. Your surgeon then cuts a piece of intestine and brings it up to make a new connection to the stomach, allowing food to bypass the remainder of the stomach and much of the small intestine. Small intestine is then reconnected, creating a Y, where food and digestive juices can mix. The separated portion of the stomach stays in the body, but no longer sees food. Like the vertical sleeve gastrectomy, your stomach pouch is smaller, so you feel full sooner and you eat less. The bypass also works by limiting the intestine's ability to absorb calories. This produces additional benefits relative to the sleeve. While a sleeve gastrectomy patient can expect to lose 50 to 70% of excess body weight, a bypass patient can expect approximately 60 to 80% of excess body weight. The bypass is also a significantly better procedure for the treatment of reflux and heartburn, as well as type 2 diabetes. The bypass also has its own unique risks. First, there is a 5 to 10% chance of an ulcer forming between the stomach and small intestine, which requires medication and possibly surgery. Smoking, including marijuana, hookah, and vaping, alcohol consumption, and medications such as steroids and NSAIDs like ibuprofen, Motrin, Advil, aspirin, and meloxicam increase the chances of an ulcer. Be sure to talk with your surgeon if you take or plan to take any of these medications. Second, at the Y connection, there's a less than 1% lifetime risk of intestinal blockage, which would require emergency surgery. Third, about 20% of bypass patients can experience dumping syndrome. This causes fatigue, belly pain, heart racing, sweating, and diarrhea shortly after a meal, particularly after high-calorie meals. This is usually managed with dietary modification, but may require medication as well. Finally, the bypass carries a higher risk of malnutrition over the course of a patient's lifetime, making vitamin supplementation a lifelong commitment.
Our mission is to safely perform bariatric surgeries in the highest standard to ensure your best outcome.
We'll provide you with nutritional counseling to ensure dietary fulfillment for the rest of your life.
And you can rely on the support from our team of nurses, consulting physicians, other patients, and your own loved ones as you prepare to change the way you eat and change the way you live.